Kentucky Orthopedic Rehab Team, known to you and I as KORT, and they have a new program that I'm very excited about. If you or a loved one has contracted COVID in the past and you're not feeling like yourself quite yet, they can help you. With me now is Dr. Malone. You allowed me to call you Corey.
That's right. Yes.
Thank you, Doc. I appreciate that.
Absolutely.
Doctor of Physical Therapy. I think this is interesting. Okay, you guys are calling it R2.
That's right.
Okay, so that's recovery and reconditioning, right?
Yeah, it's
okay.
A mouthful.
Boy, I'm telling you what, though, there is a void there, because I think a lot of people, you and I had a brief conversation, we both contracted COVID, and that comeback, that recovery period is real, isn't it?
Absolutely. Yeah, it can take a while. You know, so there's a lot of people that right after they've developed COVID-19, they'll go through their normal symptoms and whatnot of coughing or shortness of breath or just feeling those muscle aches and whatnot. But then after the fact, that's when you start to see sometimes like a month, 2 months, 3 months later even, you'll start to develop those long COVID symptoms that you may have heard of before. So that chronic fatigue, the chronic muscle weakness, some people are experiencing things like dizziness, balance disorders, just chronic fatigue. And so that's what the R2 program set out to try to fix. So we're seeing a lot of these patients come in now post-COVID-19. It's been 2 years since the pandemic started, unfortunately, and we get a lot of these patients come in and they're having muscle weakness, they're having shortness of air, they're having problems with things that, John, you and I, we wouldn't have problems with, right? Like just getting up out of bed and walking to our bathroom at night. That should not be hard, but for a lot of these people it is. And we're seeing that by doing physical activity, getting them out of bed and getting into physical therapy and doing exercises with them and whatnot to help get them stronger, we're seeing a lot of these people recover in a very real way. And the nice thing about the R2 program is that we've got trained clinicians. So we've developed this huge training program. It's been created and vetted by multiple disciplines throughout the entire United States. And what we did was we set out to create a protocol that was safe for patients post-COVID-19, right? So we know a lot of these patients, unfortunately, are suffering from heart conditions or lung conditions after COVID-19. And it can sometimes feel unsafe to get back to exercising. And so what we did was we looked at the research. We said, hey, these are the safe things that we can do. These are the safe parameters that we can exercise you within. And then we can get these people exercising safely. It improves their confidence and it gets them stronger and they're able to get back to life.
Wow. You see, to me, it's interesting in that, because I know this is still new territory. A lot of this we have not been through before. So, and it seems like COVID hit everyone in a very different way, very personalized way. So when someone comes in, how do you know that maybe this person is just low on energy levels, or how do you know that this is COVID? Is there something common between each individual where you go, okay, this is definitely post-COVID?
Yeah, so great question, and I'm actually really glad you asked this, because while we set out with the R2 program just to treat COVID-19, what we started to realize was this protocol applies to a lot of different populations. So not only post-COVID syndrome, but also things like COPD, heart failure, and a whole other plethora of disorders that cause deconditioning, right? So I think in the past, physical therapy used to be thought of as something that you only go to it if you have pain or if you've had surgery and you're trying to get better from those things, right? But what we realize is that physical therapists are capable of much more than that. We can help people get stronger, and our job is to work towards function. So if you're just weak or deconditioned from anything, it doesn't have to be COVID-19. It could be COPD, it could be heart failure, it could be you just haven't really been able to do anything for the last 2 years out of fear, and you're trying to get back to doing things that you realize, I can't even walk a block anymore because I'm so deconditioned. We can get you into our clinics and we can help that now. But to answer your question, the post-COVID-19 syndrome, there are very specific things that we're looking out for. So things such as elevated heart rate at rest, things such as feeling short of breath with just standing. We're looking for things like maybe your blood pressure drops significantly when you stand up, and that didn't used to happen before. So these are all things that we're checking for on the initial eval when you come in, because our goal, again, is to keep you as safe as possible while exercising you. And so when you have the therapist checking those things, they'll set up an individualized program for you to make sure you stay safe and to get you better.
So what does the R2 program look like? I mean, you've made it very evident that it can be different for everyone, but I mean a basic, like let's say someone comes in and says, my energy levels are still down. It's been 2 months. What can I do to perhaps expedite my recovery? What does it look like?
That's right. Well, I would definitely say it has to be a multidisciplinary approach, right? So if at first, within the first several weeks, we're realizing this person, they have a lot of other problems going on. Their oxygen levels are dropping, their heart rate's way higher than it's supposed to be. You know, physical therapy, while this is going to help this person, this might not be the only thing that they need to do. Now you have a skilled clinician on your side that's going to refer you to another medical professional who may be able to prescribe you the appropriate medications that you need to be taking so that your heart rate's not elevating so much when you're exercising. Give you someone that's going to help manage your blood pressure more. Maybe send you to a pulmonologist who might think, oh, well, maybe this person actually needs to be on supplemental oxygen for a little bit. And then that'll help them get back to the point where they can actually start doing these exercises. So there's a lot of things that we can do in physical therapy itself, which is just typical exercises, strengthening, managing your pain if you're having some. But then there's the whole thought process of, okay, we need to identify the people that are having a tough time and refer them out as necessary.
Yeah, interesting. You know, to me, rehab has come such a long way, and you guys can do so much to actually be proactive and prevent things in the future. I love this KORT program. So, again, how would you say that this R2 program is different from regular physical therapy? Let's say someone has, you know, knee surgery or whatever, and they're trying to get their strength back slowly. Why is this different?
Yeah, I don't know if you've ever done physical therapy in the past. Probably didn't stick a heart monitor on you or a pulse oximeter on you.
Good point.
Hopefully they checked your blood pressure, but not always, right? And so each and every session we do with the R2 program, we're putting a blood pressure cuff on you, we're checking your vital signs, and then we're monitoring your heart rate throughout the entire session.
You can measure improvement.
You got it. Yeah, absolutely. And we can make sure that you're not working too hard, too, because a lot of times people will work harder than they're supposed to, and that's detrimental as well. But we also want to make sure we're working you hard enough to actually stimulate change, and so that's what we're doing.
Doctor, I would also think that, you know, for those out there who think or, you know, have that cloud over their head as I don't seem to be normal, am I? This would be good therapy to find out, you know, are you working at full capacity, right?
That's exactly right. Yeah, absolutely. You can come in and make sure, you know, sometimes it's just that fear of getting back to it. Sometimes it's not so much a physical thing, but it's that fear, that mental block of saying, maybe I just can't do it yet. You even said yourself, you know, maybe I wasn't sure if I could work out hard enough during my workouts, right?
Yep.
And that is a very real concern.
Ooh, it was real. It took me a while. I mean, literally, I could only do 10% of my workout for weeks at a time, and it slowly but surely got back to normal.
Right.
So if someone's watching now and you go, this is me, or this is a loved one, my energy levels aren't the same, my heart rate goes up too quickly, how do they get an appointment?
So you call KORT Physical Therapy's centralized scheduling office. I don't know if you all have the phone number up there or not, but at the end of the day, you can go to KORT.com. It has our phone number on there for centralized scheduling. They will find one of the over 60 clinics that KORT has throughout Kentucky and Indiana, and they'll find every location provides the R2 program. So should you have this problem, get on KORT.com, you can schedule on there, and then they'll get you to whatever clinic you need to get into. And typically we can get you in within about 24 to 48 hours.
Fantastic.
Yeah.
Dr. Corey Malone, really good information. Thank you so much.
Absolutely. I'm happy to be here.
Yeah, I'm happy that you're here. It's good information, the R2 program available at KORT Physical Therapy. Okay, coming up here, Mom, Dad.